You're watching Eye on Africa here on France 24. I'm Julia Kim. These are the headlines on the continent. Doctors across Nigeria begin an indefinite strike as the country faces a third wave of coronavirus infections. Unpaid salaries, insurance benefits, and poor facilities, just a few of their grievances. The United Nations warns that Burkina Faso must act quickly to protect its children. Young people pushed further into poverty by the pandemic are increasingly being preyed on by jihadist groups. And frustration among French people living in Senegal. Thousands are unable to obtain a COVID health pass because they haven't been vaccinated with an EU-approved vaccine. But first, amid a surge in COVID infections, Nigeria's frontline doctors have begun an indefinite strike. The country's Association of Resident Doctors says they're striking over the late payment of salaries and bonuses for treating COVID patients. The union represents over a third of physicians in Africa's most populous nation. Take a listen.
Some of our members are being owed salaries of up to 10 months, some up to 8 months at the state tertiary institution. And we believe that as we speak, what I get and other health workers is 5,000 as hazard allowance, considering the enormous hazard we are exposed to. This, we believe that even federal government is playing politics with it, with the issue of the improved hazard allowance, which is not proper. Thinking about the third wave and the Delta variant. But the truth of the matter is that there's no better time to say we want to proceed on a strike action, because we can only give our best if all the enabling environment is provided. And that enabling environment includes our welfare, which borders on remuneration that is due us.
Well, it's the fourth time doctors have gone on strike since the start of the pandemic. France 24's Sam Olukoya has more from Lagos.
This strike involves doctors who belong to the Nigerian Association of Resident Doctors. Reports from several parts of Nigeria indicate that activities were paralyzed in a number of government-owned hospitals. Patients were prematurely discharged, while new patients were not attended to in several hospitals. The striking doctors say they have a number of grievances. One of these is that they are being owed salaries. In some cases, salaries have been owed for several months. They also complain that they are not being paid COVID-19 risk allowance. The doctors also want insurance to be paid to families of doctors who died in the course of treating COVID-19 patients. The doctors say the strike is total and it involves all the isolation centers where COVID-19 patients are being treated. This strike comes as Nigeria enters the third wave of the COVID-19 pandemic. Figures are rising and the isolation centers are filling up again. Doctors in Lagos, the epicenter of the pandemic, are also involved in this strike. This is the fourth time Nigerian doctors have gone on strike since the outbreak of the COVID-19 pandemic last year. Health services have been stretched to the limit, and morale among doctors and other health workers is completely low. They complain of the poor state of health facilities in Nigeria. The doctors and other health workers also say that there isn't enough equipment, including personal protective equipment. It is unclear how soon this strike will end. The doctors and government have not yet come together to resolve this issue.
Well, staying in Nigeria, prosecutors have filed terrorism charges against Shia cleric Ibrahim Zakzaki. Last Wednesday, Zakzaki's 6-year detention ended after he was acquitted of the murder of a soldier. The victim had been killed in clashes between his followers and troops back in December 2015. The Shia cleric has repeatedly called for an Iranian-style Islamic revolution in Nigeria, where the Muslim population is predominantly Sunni, putting him at loggerheads with the country's secular authorities. Well, let's move on now to South Sudan, which has sworn in hundreds of lawmakers to a newly created national parliament. In all, 588 MPs from the ruling party and from former rebel factions took the oath of office at a ceremony in Juba. An inclusive National Assembly was a key condition of the fragile 2018 ceasefire that paused 5 years of bloodshed. The conflict between government and rebel forces left nearly 400,000 people dead. Poverty, violence and the coronavirus crisis have made children in Burkina Faso more isolated and vulnerable. The United Nations says jihadist groups are recruiting them to carry out attacks. It also warns that Burkina Faso must act quickly to protect children and rehabilitate those who've turned to terrorism. Shelley Sitbon reports.
It's an unprecedented phenomenon that Burkina Faso wants to stop as quickly as possible. Jihadist groups have recruited children. Almost unheard of before in the Sahel country, children are now being detained after allegedly taking part in terrorist violence, including the deadly attack in Sohan in early June.
Les assaillants étaient en majorité, par exemple, des enfants dont l'âge est compris entre 12 et 14 ans.
Burkina Faso is now, for the first time, studied in the UN's report on children and armed conflict. Dozens of schools have been attacked. Children have been abducted and abused. Others have been recruited by terrorists.
Ces enfants n'ont pas accès à une bonne éducation. Ces enfants n'ont pas accès à un minimum de décence, à un minimum de santé et à un minimum de dignité humaine. Ils sont pour cela, de ce fait, des cibles et des proies faciles pour les groupes extrémistes.
Parents facing poverty, violence, and isolation, in part due to COVID, feel helpless. Aid groups call for a plan of action, provide education and care for families, and psychiatric help for children recruited by terror groups to save them and stop the violence.
Now, France's recently expanded health pass proves the holder is vaccinated with doses approved by the European Medicines Agency. But many of the 25,000 French residents living in Senegal don't have the right to obtain this document. That's because they were jabbed with the Chinese vaccine Sinopharm, which isn't yet valid in France. Well, in Dakar, France 24's Sarah Socko has this report.
In his downtown Dakar clinic, Dr. Bassoun sees his patients even on the weekends. This French doctor isn't going on holiday this year. He was vaccinated with the Chinese Sinopharm vaccine, which isn't recognised by France, so he decided not to travel. But he does consider himself protected against COVID-19.
C'est la sérologie qui recherche le taux d'anticorps anti-Covid-19. Eh bien, mon taux est largement élevé. Ça prouve qu'il en était besoin, que c'est un vaccin qui est efficace.
Dr. Bassoun doesn't have the right to a French government-issued health pass in order to access public spaces like restaurants or museums. In France, he would be subject to the same constraints as non-vaccinated people, something he considers unfair.
On m'a dit, vaccinez-vous. Il n'y avait qu'un type de vaccin quand on nous l'a dit. Et c'était seulement en février, il n'y avait rien d'autre. Donc on a pris ce qu'il y avait. C'était Sinopharm.
The situation is well known to this association. Its president is overwhelmed by calls from confused residents. On Sunday, the French government promised to facilitate access to the health pass for those who have received a registered vaccine. For the others, the possibility of an additional injection is under study.
Les gens sont très inquiets parce qu'on n'a pas de recul. Donc en plus, si on est obligé de faire un vaccin sur un vaccin, est-ce que réellement ça va avoir des conséquences? Donc le reste des gens restent sur la touche. Et donc que ce soit les jeunes qui n'ont pas été vaccinés, les délais qui sont mis en place et nous ici les difficultés qu'on rencontre pour effectivement avoir des vaccins qui sont reconnus, je pense que tout ça n'est pas réglé.
After weeks of disruption and a shortage of vaccines, Senegal received 600,000 doses at the end of July, half of which are Johnson & Johnson and recognised by France.
Now, Soufiane El Bakkali of Morocco has won Olympic gold in the men's 3,000 metres steeplechase. It's a huge upset for Kenya, which had been undefeated in the event since 1984. Ethiopian Lemecha Giema took silver and Benjamin Keegan of Kenya took the bronze. Meanwhile, in the women's 5,000 metres, Ethiopian-born Dutch sprinter Sifan Hassan bagged her first gold medal. She's aiming to win an unprecedented treble of track golds this year. Kenya's two-time world champion Helen Obiri claimed silver, while Ethiopia's Gudaf Tsige took the bronze. Well, that's it from us. There's more news coming up here on France 24. Stay with us.